Latin Americans make up a large portion of the immigrant population in North Carolina, with many coming from countries such as Mexico and El Salvador. They're a vital part of our state's economy and our culture, so it's important that we consider their specific healthcare needs as well as the inequalities that they face in the United States. This population is at a higher risk for chronic diseases such as hypertension, diabetes, heart disease, stroke, obesity, malnutrition, and mental health disorders. It's important to note that many of these conditions are going untreated and unmanaged due to some of the healthcare barriers that this immigrant population faces. A 2023 study found that the number one barrier to healthcare for immigrants is limited English proficiency. This is a serious challenge to both the provider and the patient because they can't understand each other. Spanish-speaking patients are less likely to mention their symptoms, and they're less likely to communicate their thoughts and expectations on their health conditions. And providers are less likely to spend the same amount of time speaking with their Spanish-speaking patients as they would with an English-speaking patient. These factors can cause errors in treatment, poor adherence, as well as unresolved medical conditions. Latin immigrants in North Carolina specifically tend to visit language concordant providers, which is a provider who speaks the same language as them. This improves patient care, and it's superior to a medical interpreter, but it's hard to find. Luckily, there are local resources in Charlotte, such as the Camino Clinic, that provide this service.